Thank you very much. Thank you, Yoshi, and thank you for bringing forward the importance of this concept of achieving universal health coverage. We have time for a few questions. Thank you. So I see 3 hands. Let's have the 3 questions and then we'll turn to the panel. Yes, please, the gentleman.
Stan Gozon, Capgemini, 1 comment and 1 question. Comment, it looks like prevention has a very, very strong business case, stronger than I thought initially. And you think, why are the richest countries not looking at these issues from a financial perspective? Second question. Mr. Etter, you mentioned that philanthropy as a source of financing was creating potential issues. Could you please elaborate on that?
Thank you. Madame, here in the first row. Yep.
Yes, hello, I'm Nahida Nakad, living here, but originally from Italy. I have a question for Dr. Barakat. You've spent a lot of time in Gaza over the year. I would like to know if the effects, the health effects, we all know what happened, but how do you assess the health effects, not only for Gaza, but would they spread?
Thank you. Jacques?
Jacques Biot from Joburg. Question to all the panelists. Congratulations for your presentations. We've heard from the conference that all countries should increase their defense expenses to 2-3% in the current world. We all know that education is needing a lot still of funding. We know that health systems want to get money for cure, even in Africa. I mean, we've seen that there is a lot of expense. So how do we make the case, and that relates to some extent to the earlier question, how do we convince policymakers who have a very high discount rate that it makes sense to invest in prevention, where the benefits will come on a very long term, when they will not be in office anymore, except in some countries. So how do you convince them that they should spend more money on prevention?
Thank you. And there's 2 more questions. Yep. And then we'll turn to the panel.
Thank you very much. I guess one common thread across your interventions is the need for global governance to solve the challenges you mentioned. And with President Trump coming back into office and his questioning of the World Health Organization, what are your suggestions to reform the multilateral organizations in order to tackle the issues going forward?
Thank you.
Yeah, it's a very basic question actually on the, what I would call the prevention paradox actually, on the economic and financial benefits of prevention. We all eventually die. We know that a large part of health expenditure is occurred in the few months before our death. And so prevention in a way adds to the spending that occurs when people die. So what's the answer on this?
Thank you. So let me turn to the panel. Maybe, Maha, we'll start with you. There was a specific question addressed to you.
And thank you for the question regarding Gaza. So the United Arab Emirates has done quite a comprehensive humanitarian set of initiatives to help the humanitarian disaster that's happening in Gaza. We've flown out over 2,000 of the sickest patients with their companions. These are children who've been injured with amputations and people with cancer for whom there is no treatment. So for over a year, anyone with cancer, either midway during treatment or just diagnosed, will have had no treatment and they would have died. So these individuals are now in Abu Dhabi receiving treatment in several of our hospitals. But the United Arab Emirates has done other initiatives for those that we can't fly out, because although these are 2,000, remember, I mean, it's estimated that over 90,000 people are injured, of whom the WHO says at least 12,000 are severely injured, needing urgent treatment now, and who will either die or suffer irreversible severe disabilities going forward. So the numbers are enormous, and the United Arab Emirates is doing what it can. So for those that we can't fly out, we send in humanitarian and medical assistance. There's a field hospital inside the southern strip in Rafah that has 200 beds. There's a floating hospital just on the other side of the Egyptian border that has 100 beds for those that are able to get through. There's humanitarian assistance. Thousands of tons of aid is getting in either by land or by sea or by air. So we continue to try and do what we can. His Highness the Foreign Minister negotiated a Starlink high-speed internet for the field hospital inside Gaza, so that there could be medical video conferencing with the doctors there to help treat the patients real time. So there are many initiatives, and yes, it's beyond tragic. I think I've personally run out of superlatives to describe how bad the humanitarian situation is.
Thank you. We're now at the end. I see 000 have so a brief answer, a quick comment from you, Jean-François, and from you, Antoine. There were several questions around prevention.
Yes, about funding, several questions. I would say that if you have an international treaty, then the parties to the treaty should fund it rather than rely on philanthropies, because the philanthropies, Bloomberg in this case, have different agendas, and there's no reason to let them. And to answer the point of the gentleman here, we just can't afford to have so many people costing to the healthcare system because they have diabetes or lung cancer, conditions that are completely preventable. It just costs too much, so prevention doesn't cost. And the point that you mentioned, that for instance in Geneva, the last year of life will cost on average 50,000 francs in healthcare. This is a different point. It's an ethical issue of when we should say stop giving chemotherapy. Half of the people with cancer die with an ongoing chemotherapy. So it's pointless. It just decreases their quality of life. So who will say stop? Not the doctor when he's under the pressure of the family, not the patient. So it's a reflection that we should have about death and how we tackle with death and the absolute power of medicine. Medicine, well, we're all going to die. So this is an ethical, or we can also get even input from religious people here to solve the issue of the last month of life.
Antoine, very briefly.
Thank you. Two comments, very good questions, I think. Two comments. First of all, prevention is not expensive. Prevention is cheap, because most of the preventive measures can be self-funded. For instance, healthy diet can be funded with tax on sugar, or on junk food, or on ultra-processed food. Tobacco reduction can be funded by taxes on tobacco. And we know that taxes on tobacco is a virtuous circle. The higher the taxes, the lowest the consumption. Same for alcohol. So to some extent, for sure, there is a cost of prevention. Water sanitation has a cost. But who wants to drink tap water which can be polluted by cholera or other dysenteric disease? So to some extent, it is a virtuous circle. And the second point I wanted to say is about the compression of morbidity. The concept of compression of morbidity is that with prevention, we will not tap more on pension for retirement, because we will not expand the life expectancy. Again, we will just compress the morbidity, because we will save healthy life years in our life expectancy. And when you compress morbidity, most of the economic experts say it costs much less. Mm-hmm. Because just to say, if you have to, as Jean-François said, if you have to treat a cancer, a lung cancer at 60, it will be very expensive. You will do the maximum to treat the patient. And after 2 or 3 years, unfortunately, most of them will die after very expensive expenses. If you have a morbidity after 90 or 95, you will never go to intensive care. You will probably die at home. That will be much less costly. So compression of morbidity is a virtuous cycle of, and benefit of prevention.
Thank you very much. With this, there was a lot of information. I hope you realize the spectrum of global health challenges that we're facing in 2024. And I'd like to thank, on your behalf, and ask you to thank our panelists for an excellent presentation.